talk about the management and the healthy lifestyle habits that people should adopt, especially if they're already identified or diagnosed with heart failure?
Yeah. So actually nowadays there is a lot of talk on aging and various other things. We call it a morbidity point. That
Mm,
means we live till a certain age with reasonable health, and say about, let's say cutoff for India would be a 55 when the morbidity starts, whether it is hypertension or various other diseases. After that, the health overall starts declining. And from where the morbidity starts and what kind of a morbidity you have, decide the last 7-8 years of your life.
mm,
So that's why we discuss a lot about lifestyle. It should start at the age of 40, or if you're not started, then whenever you can start as early as possible the lifestyle changes. So if you do those, we'll discuss those what they are. Then you prolong your morbidity point. You go closer to your end of life.
you push it
Yes,
further.
and that's why finally the end years of your life are reasonably good. They are not very morbid, is what we think of. And this, because life expectancy over a period of decades or centuries has just gotten up by about 7 to 8 years.
Mm,
But the morbidity point certainly has moved closer to our younger age groups. So we have to push that closer to the end point. So our end part becomes better. The lifestyle changes are again oft repeated, but I have to say that again, a correct common sense diet, eat for your body, not so much for your tongue. There could be some cheat days, but most of the time you should be eating for your body. Um, 150 minutes of exercise of any kind per week is required. As time goes by, little weight training is definitely desirable to prevent muscle mass deterioration. Mental stress is a difficult ball game to deal with, but each one has its own way of looking at things. And regular checkups with the doctors, maybe every 6 months, 1 year, based on what you are and what your medical conditioning is. So diet, exercise, abstinence from smoking, and of course, stress management are all these principles very well known, but they have to be implemented well. That is where the
mm,
Achilles heel is. People don't just know about it and don't and they take it lightly. It should start at the age of 40 very well, and of course, whenever you are gotten aware about it, you can start doing that. So by doing that, preventing your keeping your muscle mass intact, common sense diet, exercise, and definitely will help prevent HFpEF.
right.